Claire Burton ran her bike into a car on Michigan Avenue. Vital stable. Can't get any answers out of her, but she definitely looks pregnant.
Claire, I'm Dr. Manning. Do you remember me?
I used to eat a lot of carrots, but they don't really help your eyes. I don't really need them anyway, because the carrots, they don't really do anything.
Yes, bipolar. I treated her a few months ago for morning sickness. All right, let's move her on my count. Ready? 1, 2, 3.
Anybody we should call?
As far as I know, the boyfriend's out of the picture.
Sometimes if I look at something for too long, I feel like all that energy is going to turn into a laser and just burn a hole right through whatever it is that I'm looking at. I heal a lot faster than others.
Claire?
Like suddenly...
Does it hurt anywhere?
2 Haldol, please.
A lot of times I try not to look at anything
Claire.
but myself.
Claire, can you tell me if anything hurts?
Every single molecule of my skin.
She'll calm down in a couple minutes and
activated.
right outside.
Okay, thank you.
And I just heal. Does anybody know what happened to my bike? It's just a cut. Maybe I could just get my bike and go.
What was her normal dose of quetiapine?
It was 800 milligrams, but I cut it in half to be safe for the baby.
Huh. That might explain the onset of the mania.
Well, the standard of care is to cut the dose in half.
And there's actually been some new research, a couple new papers, both suggesting that more
Dr. Charles,
gradually.
I can't keep up with every psychiatric journal.
Of course you can't.
Or I didn't have a choice. I did what I had to do.
Dr. Manning.
What's wrong?
Your placenta must have abrupted from the accident. Call OB, we need to get her upstairs for delivery.
Delivery? Did something happen to my baby? Is he going to be okay? What's wrong with my baby?
Everything's gonna be fine. Let's get you upstairs, and then we'll figure out what happens next, okay?
Are you sure I didn't hurt the baby? Are you sure? What if I hurt it? What happened? Why did we stop? What's going on?
I don't know.
Why are we here? What is this place?
Orthopedics. They're renovating the rehab floor.
I'm supposed to have my baby. You said I was bleeding.
Emergency exits are locked.
I was thinking maybe a code orange would explain why the elevators went down.
Oh, there's a lot more blood. A lot more blood.
Her bleeding's much worse. Call labor and delivery.
Worse? What does that mean? Is my baby dying?
No, we need to lay you down, okay? Come on.
He's dying, isn't he? My baby's dying.
No, he's not. Come on, let's lay you down. Just lay down right here. You're all right. There you go. Dr. Charles?
There's no signal. I can't find a signal.
Oh my God, I killed him.
Just stay right there, okay? We have to figure out a way to break open these doors. We need to get her upstairs.
Natalie, we're not getting through those doors. We're gonna have to do a C-section.
It's all my fault. I killed my baby.
I've never done a C-section. I haven't even seen one in years.
We're gonna figure it out.
But we don't have any instruments or emergency supplies or pain meds.
There's gotta still be some supplies on this floor.
What if we just held pressure? I mean, whatever's happening in the hospital right now can't last forever.
We have to do this now. We don't have a choice. Listen, whatever doubts you may or may not have about your previous treatment of this patient,
I led her to believe that she could go through with this pregnancy. She can't take care of a baby. She can't even take care of herself.
and you were in a very difficult situation.
If I operate on her in this hallway and she dies, that's my fault.
Okay. Okay, look, I'm going to find a signal and get an OBGYN on the phone.
But no one can get down here.
No. So she can talk us through it on the phone. Together. Okay?
Do you have reception?
We got one bar, it's ringing.
I'm not cutting until you get someone.
Cutting melon, cutting chicken, cutting meat, cut the baby.
No one's gonna hurt the baby,
chicken's
Claire.
gonna cut the
Her
baby
Haldol's
chicken.
wearing off. Is someone answering?
Yes, this is Dr. Charles. I need an OB immediately to talk me through an emergency C-section. They're getting Dr. Grant.
Come here and put her on speaker.
I can't. I'll lose the call. I'll drop the call. Dr. Grant, thank God. I have a woman, 36 weeks, abrupted placenta, already lost a couple units of blood. Some lidocaine, which we've administered, a scalpel, and a few clamps. Okay? Okay, here we go. Dr. Grant says to start the incision 3 centimeters below the umbilicus.
Okay. Here we go.
She's through the uterine wall.
Hold on. The placenta's in the way. I can't see the head. Ask Dr. Grant if I should extend the incision or reach through the placenta.
Can you reach around it? Is there any room?
Ask Dr. Grant.
Yes, Dr. Grant. Dr. Manning wants to know if she should extend the incision or go through the placenta. Dr. Grant says that she totally trusts you to make that call.
No, she needs to tell me which way to go.
Make the call, Manning. Manning makes the call.
Dr. Grant says that without being there to assess the position of the placenta, there's no way that she can make that determination. You need to decide.
I'm going through the placenta. It's too high. I need you to come over here and push down on it.
Here?
Yeah, I think so.
Okay. I'm sorry, but you're gonna feel this.
God, get out of here!
You got the baby?
No. Maybe I should do the incision.
Get off me!
Push. Got it. Got him. Keep pushing. I got it. He's not breathing. His trachea is blocked with secretions.
What do you need?
An aspirator, something to get the secretions
Oh
out.
my God, is IV tubing.
Give it to me. It's okay.
You did it.
Yeah. Dr. Grant, how's Claire doing?
She and the baby are both stable. You did a nice job.
Well, I couldn't have done it without you.
I don't follow.
The phone call with Dr. Charles. Thank you for getting me through the C-section.
I wasn't on any phone call.
Dr. Charles, you lied to me.
Yes, I did.
You tricked me into doing a surgery that endangered both Claire and her baby. What you did was reckless and unprofessional. You had no right to manipulate me.
Can I show you something?
She looks good.
Yeah. Meds kicked in. Listen, you were trying to solve a very tricky problem, and most doctors would have tried to talk her out of this pregnancy. But you saw the woman, not the mental illness. You have excellent instincts, Nat. Just gotta trust them. Allison, how you doing? Well, here, take it easy there. Easy, easy, easy. Allison, I'm Dr. Charles.
Shrink.
So, something tells me this isn't your first time in an ED.
Not just saline, is it? D5?
Well, your blood sugar is 44, so, you know, the dextrose is...
Hypoglycemia and all that comes with it, I know. But 170 calories per liter. If I can get 80 from that, no, I come back as 4, that's 320.
So, is your math working out? You're gonna be able to burn off those extra calories?
I don't need to be here. Check my levels. Vitamins, potassium, they'll be normal.
What is the go-to trick these days for, you know, gaming those numbers? You guys still sucking on lemons? Or, I don't know, I heard that guzzling vitamin water is kind of coming into vogue. I mean, it's none of my business, but I am curious. How long has this been going on for? 5 years? 10? 15 years. At least 15 years.
I want to go home.
Okay. Allison, you know, if you can't get out of bed, you know that I can't let you go, right? And you do know what that means.
$500.
5,000.
1,000.
4,000.
1,500.
3,000.
2.
3.
Fine. 3,000 calories.
And it has to be through your nose.
This goes.
Got yourself a deal?
$3,000 calories?
It's all she's willing to accept.
Why are you negotiating? Dangerously low albumin, renal insufficiency, 5'6", and less than 70 pounds. Dr. Charles, I carried her and she was nothing. She needs high-calorie, long-term nutrition.
I agree.
Then what are you doing?
Anorexia is actually the most deadly mental illness that there is. Every instinct she has is telling her to resist this, and I don't want to push her any harder than she'll let us.
Then let me push her.
No. I made a deal. We have to honor it. Trust me, it's our best shot.
Listen, we get 3,000 and you'll go back for more.
Of course.
Dr. Choi, Allison's parents are here waiting room.
Thanks, Max. I'll fill them in, then place the feeding tube.
Is she the worst case you've ever seen?
Healthy BMI is 18 to 25. Hers is 11. She's gonna survive. We can't afford to make any mistakes here.
She's killing herself.
Allison, I'm gonna put this tube in your nose. When you feel it in your throat, I need you to swallow. Allison, do you understand? Okay, here we go. Swallow. Allison, swallow. There you go. It's going in. Nice job.
It's going to work this time. We've tried helping her for years. Doctors, rehabs. No matter what we do, she just keeps withering away.
You know, sometimes being out of options is what it takes to instill the desire to get better.
X-ray. Tube's in. I'm gonna turn on the pump now.
Allison, look at me. Slow breath.
I can't.
Yes, you can. You can do this.
No.
You're fine. You're absolutely.
Just relax.
Stop it.
Just relax.
I can't do it. I need it out.
Hold on. No. Let's try again.
No. I'm done.
Allison.
I said I'm done.
Why don't we give Dr. Choi a moment to prepare another tube? Maybe we
You're
can...
not hearing me. I want my lawyer. I'm serious. Get on my phone. I'm calling my lawyer. Now.
Chicago PD dropped her off this morning. They found her loitering outside of a convenience store, jabbering to herself, disoriented, no idea where she'd come from or how she got there.
Pamela, I'm Dr. Charles.
You're not Bob.
No, but you can call me Daniel. Do you mind if we ask you a couple of questions? Dr. Wheeler was thinking that maybe you're feeling a bit out of sorts. Do you know why you're here?
I just wanted some ice cream and
You know what? I think I might be able to help you out with that. What flavor were you thinking?
cookie dough.
Oh, dang. That's my favorite. You mind if I look at your hand? Oh, boy. You have really beautiful nails. You know what, Pamela? I'm gonna see what I can do about that cookie dough, okay?
Okay.
Thanks. I'm gonna need a CBC, CMP, and you better page cardiology.
Why? I called you in for a psych consult.
She's not psychotic, she has endocarditis. You didn't notice the fever, splinter hemorrhages under her nails?
Cop said that she was having a psychotic episode, so I just assumed that.
An infection is attacking her heart and sending microstrokes to her brain.
Okay, so we should page cardiology, right?
You know what, Jason? I think I'm gonna take this myself, but good work, really. I mean it. Maggie?
Already on it.
I was thinking it might be a good idea to loop in epidemiology, you know? Maybe Dr. Robin Charles, just to be safe.
Where are they taking me?
My friend Dr. Berger, Alvin, is taking you upstairs for a quick test. Gonna take about 5
No,
minutes.
please don't leave me, Daniel. Please don't leave.
Okay. All right. Listen, Pamela, Dr. Berger, Alvin, really knows what he's doing, and this is gonna literally take about 5 minutes, okay? Why don't I take you upstairs and get you settled, okay?
Okay.
Okay, here we go.
Hey, Dr. Charles, I just got off the phone with cardiology. Your patient, Pamela, they just confirmed endocarditis.
They putting her on antibiotics.
No, the plan is to remove the vegetations and reconstruct her aorta. She's going into surgery now.
Surgery? Who authorized that?
Oh, what's going on here?
Evidently, there's an issue with consent. Surgery's been canceled.
Canceled by who?
By me. Hey, Pamela.
I laid out everything for her. I explained the risks, her alternative. I have her signature right here.
That's scroll.
Doesn't matter if you approve of her penmanship. I have her consent.
Not her informed consent. She's way too impaired to make that kind of decision right now.
So you're gonna make the decision for her. We can't get the consent that you're insisting on without first performing surgery.
Sounds like a catch-22.
She needs the surgery. It's urgent and necessary.
Of course you think that. You're a surgeon. Your inherent bias is to cut.
What about you, the shrink? You don't have a bias?
Well, I'm not afraid to admit that I'm biased. My job gets a lot easier if I can get my hands on that infected valve.
You know what? Unfortunately, not really open for debate. Performing surgery without actual informed consent is by law assault. I mean, you should thank me, doctor. I'm trying to save you a lot of legal bills.
Well, Dr. Charles, I hope that when you're done trying to prove a point, I still have time to save her. Now, if you'll excuse me.
Pamela Blake, how you doing? I just came to see how everything was going.
Much better, thank you.
Great. I'm really glad to hear it.
I'm sorry, you are?
I'm Dr. Charles. Daniel. We met earlier today when you got to the hospital, you remember?
Oh, yeah. Right, yeah.
Okay, well, I'm happy to see you're doing so well.
Glad to see she's finally coming around.
Yeah.
We're gonna have to agree to disagree on this one, aren't we?
Yeah, we can just disagree, too. That'd be all right.
Kramer went through a stained glass window, found him wandering the streets.
Mr. Kramer, can you tell what happened?
They're coming for me. The demons. GCS 13, BP 86 over palp, arterial bleeding in his forearm. Tourniquet applied in the field, but he's still bleeding.
Okay, let's transfer on my count and watch out for the glass, okay? Ready? 1, 2, 3. Oh! Doris, let's take a look at his arm.
Did you see them? The demons?
Try to stay calm, Mr. Kramer.
They're after me.
Heart rate 134, BP 86 over 52.
That's hypotensive. Bolus a liter of LR and give him 2 units of uncross-matched blood on the rapid transfuser. All right, severed his radial artery. Give me hemostat and a silk tag. We need to get control and tie it off.
They're here. Please believe me.
Chlorovac.
Got you, Mr. Kramer. Just try to stay calm.
No.
Page vascular
Got it. Bleeding's under control.
Can't you see them?
Pressure's improving.
No, demons everywhere. Help me.
We're going to Mr. Kramer.
Let's get him in soft restraints, and we're gonna need a psych consult.
Get away from me. Get away from me. Don't you see them? The demons. They're here. No one is safe. Why don't you listen? I keep...
Actually, Dr. Charles, there's some patients. I need to check them upstairs.
Okay.
They won't stop. They will find me. They were looking for me.
Paramedics say he somehow went through a window.
No one is safe.
Poor fella. Mr. Kramer, I'm Dr. Charles.
I can't stop them. Nobody can stop them. They're gonna find me here.
Them?
The demons.
You know what? I can understand how demons would be very frightening.
They're gonna take me with them.
I'm not gonna let that happen. You're safe here. 5 of a lens beam?
Yes, doctor.
Safe.
We're giving you something that's gonna calm you down a bit, and you should be feeling better pretty soon.
Better?
I'm just gonna step out for a bit. And when I come back, you and I, we're gonna start to figure this out. All right? Okay? I'm gonna let the lens beam mellow him out a bit and come back and see if I can get a better picture of what's going on.
Yeah.
But you're not seeing him now.
They're gone.
What do you think they want, the demons?
To get inside me. That's what they do. They get inside people. Make them do things. They got inside my friend. I had to get away.
Yeah. And that's when you hurt yourself.
Yes. The window. I had to get through it.
How long have they been after you?
A long time. Years.
Running all that time. Hiding. It sounds exhausting. You must be very tired.
Tired. I am so tired.
Yeah. You know, Vince, I can provide you with a place where you can rest. Would you like that? Clean bed, shower, place where you can feel safe.
Yes, I would like that.
Okay. Okay. Great. So, hallucinations, paranoia, hyper-religiosity. This is definitely some kind of delusional disorder, bipolar 1 maybe. I don't want to have him admitted, for a full psychological evaluation.
Okay, let's start working on the transporter.
Thanks.
Sure.
Get away from me. No one is safe.
Kramer, you need to come with us.
Listen to me. The demons are here.
Detective, what are you doing to my patient?
Dr. Charles, you don't
Why didn't you
understand.
page me?
You said I'd be safe.
Dr. Charles, let us do our job.
No, you give me a moment. Let me do mine. Vince, nobody's going to hurt you. I'm not going to let them hurt you, all right?
You can't stop them.
Call Code Silver.
Get away from me.
Vince, look at me. Look at me.
You lied to me.
No, I didn't lie to you. I promise. There's been a big misunderstanding. Vince, look at me. Look at me right here. Nobody else. Ignore everybody else. Look at me. What I need you to do, I need you to lower the paddles, okay, so we can talk this out. I promise you, everything is going to be okay. All right? So just slowly. There you go. There you go. Nice and easy.
Liar!
Dr. Charles, can you hear me?
Are you okay?
Whoa, easy.
Daniel, stop. You were shocked.
Check your heart rhythm, run an EKG.
I'm fine.
Don't be stubborn.
Dr. Charles, you could have been killed.
Where are you taking him? What are the charges? Stop him. Can't you stop him?
No, and what the hell were you thinking, risking your life? It's a police matter.
How did it become a police matter? He's my patient.
Let me explain.
Look, what? That it's a good idea to lock a man up who's in serious need of treatment? Put him behind bars? Blow any chance we have of helping him?
Dr. Charles,
what did he do?
please.
He broke a window.
He stabbed a priest.
What?
Father Novak died in our trauma room. He was covered in the same stained glass as Vince.